This is like definitely coming off of like undetectable trend, like the Lindsay Lohan glow up. Like everyone's like, what on earth? Like, what water is Lindsay drinking? I want that. And we're like, it's the facelift water.
Hey, if you maintain your weight and you're active and are into exercise as well as a great diet, you definitely don't look your age.
They want medical grade skincare for their birthday presents. It's wild. So Gen Z started all of that.
And I don't know if you've noticed where patients they want more collagen, maybe they don't say it as much, but I do know that some of my millennial patients have asked me, "Hey, have you heard of this phrase called collagen banking?"
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Hi, this is Dr. Roy Kim with Dr. Kristy Hamilton, and we are both part of the Beauty Scientists. And today we'll be talking about generational differences in plastic surgery. So we're trying not to stereotype people, but obviously generations trend from younger to older. And so what's interesting, Kristy, to me is that Gen Z, they've always been in a conversation about beauty, but they are definitely getting some interesting, less surgical as well as surgical interventions. So what have you seen in Gen Z in terms of the face and in terms of actual surgery at a relatively younger age?
Oh, yeah. I mean, this is Gen Z is TikTok generation. So they're getting a lot of information. They're highly interested. I mean, even Gen Alpha is their 13-year-old. They want medical grade skincare for their birthday presents. It's wild. So Gen Z started all of that. And so they're very like, conscientious of their appearance. It's men and women, which is also interesting because men generally, for the most part, like try to escape all of this. But the Gen Z guys are also in it now with the mewing concept. So we'll talk about. But Gen Z, I think they are more informed. I think they're better informed than plastic surgery candidates than we've ever had. They've done a lot of research coming in. They're using medical and surgical terminology when they come in, and they see a lot of beautiful results on social media. And I think that encourages them to maybe pursue interventions for things that they want tweaked earlier. And even though we're having like very like subtle results, because obviously like they're young, they're in their 20s. So I think surgical brow lift, like mini brow lifting. I do a like endoscopic mini brow through a 1.5 centimeter incision in the hairline. So they love that because they get that nice, beautiful like cat eye arch look without any major incisions. Small volume breast augmentation, they're very interested in the in front of the muscle preservation breast augmentation, and even these mini lip lifts that we're doing for the girls who've had like filler fatigue. They don't want it to be so puffy or out, but they do want to see more of their upper lip. So that's what I've seen in my practice. What about you?
I have seen, similar to you, interest in it, but the big thing for me is the mini brow lift. So patients, non-surgically, they are interested in the Botox brow lift. But
This
if they
is
want that result on a long-term sort of level
long
where they don't really
lasting.
want to come, yes, lasting result. Yes, definitely the mini brow lift. You make, for the viewers out there and listeners out there, what Dr. Hamilton is talking about, and I'm talking about, you make an incision in the hairline and you can actually do dissection to lift up the side portion of the brow. And that is a very long lasting procedure. It's very small, typically done under local or local sedation. You can get general anesthesia if you want, and the results look fantastic in terms of a smaller procedure for the face, but patients love it.
They love it. And so it gets that more arch to the eyebrow. And it, since we're only doing the sides, you're getting more of that cat eye look, and you never get that surprise look because the surprise look you got from raising the inner portion of the brow a little bit too much. And so since that stays the same, we're just increasing the arch. And that higher brow position also positively influences how your eyelids look too. So that's something that sometimes patients are coming in now saying like, everyone used to always come and say like, I need my eye lift done. And sometimes like we as plastic surgeons are like, oh, actually your eyelids are okay. It's the brow. Because when you pull up the brow, you see that the eyelids improve significantly, or maybe you just need a smaller upper eyelid surgery with that. But the patients are now like, they're much more informed about the relationship between the brow and the eyelid. And as I come to the camera, you can see if I push like my eyebrow down, all of a sudden I've got a lot more eyelid skin. And then when it comes up, that goes away. So there's a really like close relationship there. And Gen Z like actually knows about that, which is interesting. They're also totally skincare obsessed. skin,
Yeah.
all this. It's like, what treatments are you doing? Like, obviously medical grade skincare, but like what in-office treatments are trending with Gen Z for glass skin?
I think the biggest thing is sort of expensive to actually get a long-term result, but they are definitely interested in it, where we give a Botox slash HA filler skin facial. So if you
Mhm.
get a fair amount of Botox, liquefy it. You get a fair amount of HA, also liquefied, in other words, reconstituted with saline, and inject tiny little areas, tiny little blebs all over your face, or actually inject it just underneath the skin. You're going to have glass skin where you look great, your skin glows, it has actually fewer pores, and you look younger. And that should last, honestly, about 4 to 6 months. But that is sort of a pricey procedure because of the costs of doing business here in the US. In Korea, which I've gone to a lot recently, the cost is a lot less. The problem is you get to fly to Korea, which tends to be a little pricey from the United States. So I'm not certain if the cost overall is less expensive if you fly out there. But that is, to me, the best, longest lasting way of achieving glass skin. Do you know of any others that are maybe less expensive?
Not less expensive. We offer that one in the office too. You're right. It's like all the components. We add some like antioxidants and other things too, but like it infuses your skin with all this goodness. Like I tell patients, it's like similar to like all the what you're trying to achieve with your medical grade skincare and works, but like the skin is a barrier. So the problem is always like we're applying all this stuff to our face and like hoping some of it gets in there. But this we actually like take it and we go like in the skin itself. So it's not filler, you're not volumizing, you're like truly like attacking the pores, texture, tone, all of that, like it within the dermis itself. So that is really beautiful. We've also started like after we talked about the salmon DNA or salmon sperm facial. So I got that done a couple weeks ago, and so that's been kind of cool to watch. So we injected around my eyes and then microneedled the rest of my face in just to try that. I feel like that's like again more regenerative technique, but I feel like just some sunscreen on today. I feel like it
Oh, great.
looks nice.
Because,
And I'm also excited to try that product, which is the PDR, the polynucleotides. I'm excited to try that as a topical application after more aggressive laser resurfacing. So that's something we're talking about and patients have started to ask for. So we're doing those in the next couple of weeks. So I'll report back on that.
oh, that's awesome. So you, I assume, got the PN that is from Canada, correct?
Yes, we got the VAMP from Canada,
Yes.
FDA approved in the United States now for use with microneedling. We're off-label injecting it too, but I always feel like
Yes.
Canada's a very safe place. I feel like it's safe
Yes.
there, good there. We obviously still don't have the original Regeron that you told me about long ago because South Korea is always so ahead. That's exciting to see if that takes off in the U.S. We know the celebrities love it, apparently. So we're told.
Yes. So what Dr. Hamilton's talking about is a similar product, but made by a different company, a Canadian company that is salmon sperm, DNA derived PNs, polynucleotides. So it's a skin booster. You know, we inject it underneath the skin and your skin increases collagen growth. Regeron is the granddaddy of them all. It's a Korean company. It's a fantastic product. It's in multiple countries, CE labeled. I sound like a salesperson now, but it is not available in the US technically, yes. So we're all eagerly awaiting that use in the United States. So getting back to other Gen Z topics, one of them is, do you know of any like new sort of filler alternatives that aren't fat, aren't necessarily HA filler, but we can use today?
Yeah, so there's like this whole like natural movement trend too. So as we've talked about, filler is not a bad product. It's a good product, but it's been horribly overused. And so that led to some bad PR. So a lot of patients are coming in now, they're like, I don't want filler. I'm just like not interested. And so we've seen an increase in Renuva, which is one of these like adipose extracellular matrix scaffolds, which we'll have to explain what that means. Basically like an off-the-shelf product that like helps support like your own tissue ingress. So it's like natural. And doesn't have the like swelling or like hydrophilic, like water drawing in a characteristics that filler has. And then you and I have talked about dermaclay and aloclay. So that's like cadaver fat. It's not FDA approved yet, but it is being trialed in the US. And so we're kind of eagerly awaiting that. I got an update from the rep. So we were hoping it was going to come out in March. And apparently the issue that they're having is shelf life. They still can only stabilize it for a 3-month shelf life. And so that's not quite long enough. So they're working on making that longer before they release it out in the wild, is what I've heard. Are you seeing an uptick in treatments like Renuva is old, like that's not even new, but it's really, again, like I think TikTok, social media, like all of a sudden people are asking for it.
I have not seen an increase only because I think my average patient has enough fat. Even if you're pretty thin, most human beings have enough fat for certainly facial fat injections and fat grafting. So you have to be really thin and also want it in, let's say, the breast or body area to sort of be a candidate for these products, in my opinion.
Yeah. So I think it's on like the med spa side. So surgeons, we're always going to say, hey, you're fat, like that's the best possible option. You got the best retention, comes with your natural like stem cells. It makes your skin glowy. Like it's awesome. And it's abundant because it's yours. So I also like, it's so easy for us to go in and just get a little bit of fat without even having to put you in sleep. So, but I think if you are like a nurse injector, perhaps like that option's off the table. So then they like pulling the off the shelf, more natural product. But I'm with you. I personally do more fat transfer than this just because it's also a fraction of the cost for patients and longer lasting because like the per syringe dollar amount is high compared to your own fat, which is like free. We just have to get it.
Absolutely. And then for the listeners and viewers out there, yeah, I mean, what Dr. Hamilton says, correct. This is more of a med spa thing. If you're a plastic surgeon, it's not technically that difficult, and we could do it in the office under local to get a tiny or small amount of fat for your face. If you're not capable of doing it, then you can't offer liposuction. So I do think that this is an important differentiator. One of the common things that, that's sort of old, but is increasingly popular is PRF, the platelet-rich fibrin. So we, get your blood, spin it, and instead of getting PRP, which is platelet-rich plasma, so the yellow liquid, we can actually spin it in a different way to get PRF. Have you noticed your patients want more and more of that?
Yes. And I kind of quantify that. It's like not truly a filler, right? But it's more this regenerative medicine concept. So I think it works really nicely for the tear trough area. So an area that filler, you have to be like really an expert injector and really have excellent patient selection to have great filler results, which you absolutely can. But we see a lot of patients coming in that have had too much filler, just weren't a good candidate for filler in the first place. And so we're dissolving that and either doing fat transfer or something like the PRF injections if they're not quite ready for a small surgical procedure. And I think it's quite brightening. I've been going crazy the last couple of months. I've been trying everything. So I had that too. Dr. Franco in my office did that for me. And I thought it was like really, really nice. I wouldn't say I needed significant volume, but I think it nicely kind of brightened the area. The skin was nicer. I don't see the little veins around the eyes as much. And it was just about 3 days of a little bit of swelling there. I had like 1 or 2 tiny bruises, and we just placed it just like we would sometimes do under eyelid filler with the cannula. So really nice. And I sprinkled it all over my face. So I think PRF is like salmon DNA, the like PRP, the microneedling, like I kind of put in like my face preservation category. So I think when patients come in, we've done some structural work with filler, we're doing the Botox, we're doing like lasers to maintain their skin. And then they're like, okay, what can we do? Like we're in like good shape now. That's where I think all these treatments come in, is like ways to preserve the good work that we've done. I don't think any of them like are transformative. So if someone really wants a major change, then I think we're reaching for other tools, surgical or non-surgical.
That's great. I mean, one thing going to the next generation, and we'll talk about this a little more, are the millennials. And I think a huge trend is collagen banking. So we sort of touched on this a little in terms of, if you're a millennial, you're hitting your late 30s, early 40s, and you're a woman, you're going to hit menopause, a huge drop off in collagen. And men, as we age, we're hitting our 40s. And there's also a big drop off that's very consistent for all men going into the 40s and 50s. And I don't know if you've noticed where patients, they want more collagen. Maybe they don't say it as much, but I do know that some of my millennial patients have asked me, hey, have you heard of this phrase called collagen banking, which essentially means we're doing anything and everything naturally and with intervention to increase the collagen in your skin so it retains its youthful structure. I don't know if you wanted to comment on that or if your patients are asking for it.
Oh, I think college, everything we do is geared towards like collagen, like increasing, preserving. I was definitely someone that I've come around, the original studies I read on drinking or eating collagen, I was like, I'm not sure I buy that. It's such a huge molecule. And I still think if you have like an excellent diet, you probably still don't need collagen supplementation. But who's eating perfectly every single day? I know I'm not. So I've now come around to like even if I know we're breaking down the oral collagen that we're eating into amino acids, at least we know we're getting those amino acids, and then I think that's how we're absorbing them because that molecule is so huge. We're not taking that directly into our bloodstream. But yes, I think most of my patients are now on collagen supplements, and you're the one that like described this concept of just like the collagen like just disappearing like almost overnight. And it's so funny because once you shared that research with me, I was like, I get this is how I meet a lot of my patients. So it's interesting. Like I wouldn't have known them before, but they will come in for the first time in a plastic surgeon's office saying, I've aged 10 years in 1 year. And like, you haven't met this person before. So you're like, okay, sure. Like I don't know you. But then I was like, after we were talking about this, I was like, oh my God, this is like a really real phenomenon. And they're perimenopausal patients, right? So they're kind of like around that age, their hormones are changing. That's a whole other conversation about the bioidentical hormones. Like, we were told they were terrible. Maybe that's not quite true either. But anyhow, a lot of people don't want to take those because of the perceived cancer risk, real or otherwise. I'll leave that for someone smarter than me to comment on. But they see like really substantial changes in their skin and their like whole body, like structurally. And so I think if we can, millennials are hearing about this and they're like, okay, well, let's start now because after 25, we know we're breaking down more collagen than we're producing. So we're in this deficit. Like, what can we do to slow this down? So I think we're seeing like more like full body microneedling, full body laser resurfacing. We've started like CO2 lasering. It used to be some of the abdomen for like postpartum, like skin improvement, not tightening, skin improvement. But we're doing more and more of that now. So it's interesting. What's your take on the collagen banking?
I think it will be a trend in the future because a lot of this stuff is related to what you talked about, regenerative medicine. Essentially, we want to improve and thicken your collagen. We want to have it more organized. We want it thicker, especially in the face. It makes you look younger. It has fewer wrinkles. Your skin has better skin tone. The issue in the past or the recent past has been we've sort of been in the baby steps. Collagen banking to me is a holistic diet. You have to eat lots of collagen. Exercise improves blood flow. That also increases collagen. If you move your joints, that improves the collagen of your joints, of the tendons and ligaments, and you technically have more in your body. Then when you throw in skincare, even over-the-counter skincare, protecting your skin from the sun, that's been a huge trend over the past several decades. No smoking and better skincare. Finally, we're hitting medical grade stuff. And again, in the past, let's say 5 years, it's been baby steps where we claim that fillers help with collagen in growth. I mean, that's sort of true, but it's not that much collagen. If we're injecting fat, if we're injecting skin booster, if we're using PRF, if we're using better lasers so that improves the quality of your skin, if we now know about microneedling, well, microneedling with PRP and PRF and skin booster and other additives and antioxidants and vitamins, that really kicks microneedling into overdrive and creating even more and more collagen. So
Right.
it's a very exciting era where 2025, we're definitely going to be able to dramatically increase your collagen using your own human body's natural tissues. In other words, fat, your own, tiny amount of blood that we centrifuge, along with other products. And I think it's a very exciting time.
I think so too. And it's like you're really like
So,
harnessing the power of your own body to do these things, to your point. So it's like we're getting like because our bodies are capable of collagen production. Like that's what
yeah.
in our 20s, that's what we're seeing in teenagers, kids. So it's like they're there. It's just our cells start to get lazy. And so we just need to give it a little stimulation, a little motivation to work harder for us because we're capable of it. And then, okay, so millennials, that's me. So gotta get on the collagen. And then And then what are we seeing with like the older millennials, like Gen X? So the more like 40s,
I think
50s.
you and I have seen earlier age or less dramatic result intervention for facelift and neck lift. So between patients noticing this, whether on selfies or patients noticing due to Ozempic use or simply better lifestyle and trying to increase collagen, you lose a little weight, you have skin laxity around your neck, you have skin laxity around your face, and you're more willing, as a patient, patients may not fully understand. We as plastic surgeons, we take it seriously. We're still doing an actual correct neck lift and facelift. We're not doing a mini one. We're not doing a limited one. The good news is that since there's a little less to pull, you have quick recovery, you have a more subtle to moderate result, and you recover a lot faster, but you still notice the result. I think the downside would be you may need a second procedure 10 or 15 years from now to do a revision, in other words, to do it all over again. But I think the
Yeah.
positives are, yes, you notice a more subtle to moderate result with a lot less pain, and you're very happy with it, and you can get back to life and to work a lot quicker. If you wait too long, you have like a much more dramatic result. The issue is more bruising, more sweat, more pain, to be honest, and just a much longer recovery time. And it's not like you're hiding it from people. It's a pretty great result, but it's pretty obvious. Have you seen
Right.
that with your patients?
Totally. I mean, this is like definitely coming off of like undetectable trend, like the Lindsay Lohan glow up. Like everyone's like, what on earth? Like, what water is Lindsay drinking? I want that. And we're like, it's the facelift water, almost certainly. So that is like exactly that. Like patients are like, why do I have to look old first to then be able to look younger? Like they're just like, I see these changes happening. I don't like them. So like, can't we just like take care of this before it's like really, really bad? And the answer is yes. And especially now our facelift techniques, our brow lift techniques, like everything's gotten so good. The scarring's so good. It's so like discreet and patients heal so quickly and so well now that all of a sudden it makes sense to do this because you're not going to come out like frozen and like you're in a wind tunnel. So that, of course, you'd be like, if that was the result, you're like, okay, well, maybe if I'll take that over jowls, but you're not going to want the wind tunnel look if you're 40. Like you just want to look beautiful and youthful and vibrant and bright. And so now with like deep lane techniques, just like better facelift techniques in general, I think this is something that patients are coming in and we're talking about it with patients in their 40s and they're doing it. So why not enjoy it now? I think that's the
Yep.
resounding comment that I hear. And then moving on to the baby boomers, I think there's been, I don't want to say a boom, but there's more and more surgery being done there. So obviously like facelifts and neck lifts, always that's been a time for people in their 60s and 70s to do that. But I've also seen a lot more women having like the full body transformation. They're calling it the glam mod. Like hate that term because I'm just like, no, it's just like the mommy makeover. And so why do you think like obviously like women of childbearing age, like people in their 30s, they're done having kids or like early 40s, that's a time. Why do you think now also women in their like 60s are having like these full body transformations?
I think honestly, with modern medicine, with sun protection, with a lot fewer people smoking, you feel younger than you may look. I mean, if you look at old photos from the past, I think younger people were thinner, but middle-aged people, there was not much to do and they smoked more readily back then and drank a lot more. They aged pretty rapidly when you hit your 30s and 40s, if you look at photos from the 40s, the 50s, the 60s. Today, because of, I think, overall better lifestyle and many more people, hey, if you maintain your weight and you're active and are into exercise as well as a great diet, you definitely don't look your age. And yet certain things we just can't really fix unless you have surgery. A lot of my patients have commented they sort of want a tummy tuck, but interestingly enough, they've come to me for diastasis repair. They can't out plank and out do sit-ups to tighten up the abdominal muscles because they're slightly separated. We have to surgically repair that. So, the loose skin, bothers them. It doesn't bother them that much. It's really the fact that they don't have the core strength that they used to. And I've definitely seen a lot of patients like that in the past year. I don't know what your situation's been in terms of looking at slightly older patients with doing a lot of breast and body makeover work.
Yeah, I think there's like a couple of things. Like one, also like recovery's changed so much, with like all of our accelerated recovery protocols, like medications like Exparel that numb your core for 3 days. So I think some of these patients are looking and seeing their kids And they're just like, oh my God, like that's when my friends were having these, like it was like terrible. And it was like months of recovery. And like, they're like, this doesn't seem so bad. And yes, these patients are active. They're traveling, they're hiking, they're in the gym, and they're just like, it's not reflected in like how I look. And plastic surgery is just more accessible now, I think, than it's ever been. And there are some things, like you said, I don't care like how fit you are. If you are in your 60s or 70s, you're going to have some extra skin because that's just what happens. Things get looser. And if you've had kids and your muscles are separated, like there just is not like, we don't have a good way of doing that, of addressing those concerns without surgery. So I think like people want to look good at every age. They want to see, and when they look in the mirror, like a body and a face that reflects like their health and how they feel inside. I think increasingly as time goes on, those things, there may be like some like cognitive dissonance there. And so I think those are all motivators. And again, like our surgical techniques and the medications, all of that has just gotten so much better that it becomes something that you can do without too much hassle.
Yeah. I mean, relating to tummy tuck, the dissection is better. We don't have to necessarily open it up quite as much. We sort of have more of a central tunnel, and the sides we tend to like leave alone a little more compared to 10, 20 years ago. You talked about Exparil and long-term numbing medication. That really has made a huge difference. The ability to honestly know a little better about recovery in terms of food, in terms of preparation, in terms of more protein and all those things, it makes a huge difference. The technique of a drainless tummy tuck, and whether you totally believe in it or not, the ability to sort of suture down and have less rubbing and less seroma formation, that's a huge thing. I think honestly it contributes to less pain after surgery. And
yeah,
again, we're surgeons. We love talking about this nerdy stuff, but those are some of the surgical techniques and non-surgical techniques which have really decreased the pain with tummy tuck surgery.
Yeah, absolutely. And then combine that with like a protocol around it where we're minimizing or not using narcotics at all, like adding in a lot more anti-inflammatories, other medications. Like I tell patients, like, this is not a guarantee by any means, but like a lot of our mommy makeover patients, especially like the athletic kind of fit ones coming in, like they'll come in the next day and be like, I feel tired and tight, but like I'm not really having any pain. And even like the next week, there's like a little like tired and tight, but like it's like super manageable and they feel good, That is not what people used to say 10 years ago at all.
Yes,
They'd be like,
that's
this is
absolutely
terrible,
correct,
like everything hurts, And of course there's outliers either way, but that's the majority of people, like they do great, and they're really back, like living their lives quickly, and that's important.
Yeah. So as always, it's always fun to catch up and talk, and it's very interesting the different trends among different generations and what they want in terms of non-surgery, more invasive things, and finally full-blown surgery. Anything else you wanted to add?
I think it's just overall, like year after year, we're just seeing like all of these categories are increasing. And I think we're customizing things better to patients. We are able to deliver what patients want surgically and non-surgically. And I think everyone is like taking better care of their health, better care of their skin, all of this like prejuvenation that's going on. I think that's going to yield even better surgical results for like the Gen Z millennials now as they age and are become candidates for some of these other rejuvenating procedures. So the future is bright for plastic surgeons.
Yes, I think so too. Well, as always, thanks so much for joining me and talking on The Beauty Scientist. And to all of our viewers and listeners out there, followers, please, if you have any comments, questions, or future topics that you want us to talk about, let us know. And Kristy, as always, stay beautiful.
Stay beautiful.
Thank you for joining us on The Beauty Scientist. Be sure to visit thebeautyscientist.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.